Welcome, everyone. My name is Patrice Charlotte, Communication Specialist for Equity and Community Health. I see that people are coming in, so we are going to get started. Welcome. Welcome to Equity and Community Health's Front and Centered. During our half hour together, we hope that you'll learn and become better acquainted with the exciting work of Equity and Community Health. We encourage comments and questions, and we'll have a dedicated Q&A at the end of the presentation. We ask that you please save questions until the end and submit them using the Q&A function located at the bottom of your window. Should you have comments, please feel free to use the chat to share those with us. So now, without further ado, I'd like to introduce our host for the afternoon, Elena Olson, Executive Director of the Center for Diversity and Inclusion. But before that, I'm going to share opening remarks from Joe Betancourt, Senior Vice President of Equity and Community Health, to introduce today's program.
Hi there, my name is Joseph Bedford. I'm Senior Vice President for Equity and Community Health here at Massachusetts General Hospital. I am thrilled to kick off our first year-long series entitled Front and Center, where we get a chance to showcase all of our work in diversity, equity, inclusion, and community health. And you all will get a chance to meet our group of dedicated, committed, and expert leaders who guide the different portfolios of our work products here at MGH. So it's with that I am going to get a chance to introduce our first presenter, Elena Olson, who's Executive Director of our Center for Diversity and Inclusion. Again, as part of our front and center effort, you'll get a chance to hear from all of our different leaders. The Center for Diversity and Inclusion this year, we thought would be a great place to start, celebrating its 30th anniversary. Elena Olson being part of the Center for Diversity and Inclusion for 22 years, and ably leading our incredible portfolio of work in the space of diversity and inclusion. I'm going to talk a bit more about that now and just highlight some of the particular components of our portfolio here as we go forward. So first, our entire strategy is Mass General Brigham United Against Racism strategy. To the top right of your screen, MGH Equity and Community Health is the local implementation arm of United Against Racism. We do this with a talented team, group of individuals who guide us, executive committees on diversity, equity, and community health, that in fact will be merging and perhaps evolving as we as a system create a new set of committees that will guide our work. We have three major assets that lead our different work streams. One, the Center for Diversity and Inclusion. Second, our Center for Community Health Improvement. And third, our Disparity Solutions Center. Our Center for Diversity and Inclusion, which I'll cover more here in just a moment, really focuses on increasing diversity and creating an inclusive environment for our physicians and researchers, and has been expanded in 2021, and I'll talk more about that in a bit, with new work streams in patient care services, research, subject matter expertise in LGBTQ and disability. Our Center for Community Health Improvement really has programs around community coalitions and community engagement, youth education and empowerment, as well as our community health worker program, as well as our Disparity Solutions Center, which really focuses on equitable access to a delivery of quality care here inside our doors, and also provides guidance to our signature clinical initiatives, our sickle cell disease treatment center, as well as our equity and kidney transplant. We have as well several thematic centers that are part of our family. Our Craft Center for Community Health focuses on innovation, mobile, and other areas. Our Center for Gun Violence Prevention, our Center for Immigrant Health, and our Center for Global Health. And we provide support to this entire family, and you will get a chance to hear from leaders of all of these centers over the upcoming year. I'll next draw our attention to the Center for Diversity and Inclusion. As I said previously, we have expanded this work. The Center for Diversity and Inclusion was founded by Dr. Williams initially in the Department of Medicine, then it became the Multicultural Affairs Office, turning that into the Center for Diversity and Inclusion, initially focusing on physicians and scientists. And in 2021, as part of United Against Racism and Structural Equity 10-Point Plan, which is now part of United Against Racism, we're able to expand the Center for Diversity and Inclusion, again, with a variety of new really excited to now turn it over to Elena Olson, who will talk about the great work that CTDA has done. And she and the incredible team that she will present to you have done work not just in the area of diversity and inclusion, but also significant work around creating new policies and practices that foster respect, dignity, and attempt to address structural racism as it really focuses on our interactions with our patients and our colleagues. She's part of a team, the system that's also looking at reporting and reconciliation of these events. She's also been part of a team, and our CDI is part of a team that's been working on our advocacy efforts and certainly our diversity and inclusion work. So thank you so much for being part of Front and Center. I hope you will tune in every month as we get a chance again to showcase our key leaders here. And it's my honor, privilege, and pleasure to turn the floor over now to Elena Olson, who again leads our Center for Diversity and Inclusion, and will share with you now the great work that we are doing in this space. So thanks so much, and Elena, the floor is yours.
Thank you so much, Joe, and hello to everybody. While we get that down, I'm just trying to share my screen here. All right, we'll get this up. So good morning to everybody. I guess at this point it's good afternoon. Thank you so much for joining us today. And it's just really my pleasure to be able to provide you today with a brief overview of what we do. We've been celebrating 30 years of this amazing work in diversity, equity, and inclusion. Just give you a very broad overview. We'll also highlight some goals. You know, why do we do this? What are our main key goals? And finally, highlight just some amazing accomplishments and work that we have been doing, and much more to come in the future, because you will be hearing from some more members of the CDI team in January. They're going to focus on our expansion efforts of research and patient care services. So this is our mission, and it has been, I've been at this for almost 22 years, and CDI has been around for 30. As you heard from Joe, we started in the Department of Medicine, but we are now working with pretty much every single department, clinical and research department in the hospital, as well as patient care services. And we are really here to support, grow, advance the careers of those who are underrepresented in medicine, and specifically students, trainees, physicians, scientists, and patient care service staff. In addition, we really have a goal and an aim in our mission to create a more inclusive environment and help people really feel that they can experience a true sense of belonging and respect while they're here in this wonderful hospital of ours. So this is our amazing team. You know, we certainly could not do this work without this amazing group of people. And this team has grown in this past year alone due to the expansion. And so you just heard from Dr. Betancourt, Joe Betancourt, our executive sponsor and the Senior VP for Equity and Community Health. And then our founding director is Wynn Williams. He's a nephrologist and has really founded CDI in the Department of Medicine many, actually 30 years ago. And as you can see here at the top part of your screen, we have all our clinical and research faculty listed. And I've listed them here pretty much in order of when they joined us. So Sherry Ann Burnett-Bowie is our associate director. She's in the Department of Medicine and Endocrine. Jocelyn Carter is our manager of trainee affairs. She works very closely with all of our trainees and students. She is an academic hospitalist. Cesar Castro and Julie Price joined us this past year as faculty co-directors for research. And Cesar, Dr. Castro is in Heme-Onc in the Cancer Center, and Dr. Price is a PhD scientist in the Martino Center. And then, of course, final but certainly not least, is Leah Gordon, and wonderful addition to our team, a nurse practitioner who is directing all the efforts under CDI and patient care services. So you're going to hear more from Leah and from our research team, like I said, in January. And here on the bottom, you see our administrative staff. In growing our research workforce, we've added Karen Green, Sandra Ordenes Pena was with us before as a program manager, Amanda Pickett with our student programs as a coordinator, Patrice Charlotte, who you just heard from, our communications specialist, Bibina Shrestha, who's been with us for a while as well as our program coordinator. So as I say, it takes a village, and we are working collaboratively with so many of you that are on the call and that hopefully will be hearing this in the future. And we want to thank you for that amazing partnership, because we could not be doing what we're doing without you. So what are our goals? I really want to boil this down to two main goals. We have many goals and many reasons why we do what we do, but in this short period of time, I'm just going to distill it to two things. The first is about addressing structural equity barriers. We have a structural equity plan aligned with United Against Racism. You heard Joe talk about this quite a bit in the past, and pretty much all we do, much of what we do, and a lot of what we do is focused on that exactly. And I love this cartoon because really this structure, this fence, that is the barrier, that is the structural barrier, the policies and the practices that have been in place over hundreds of years in this country, and even in our hospital. We are over 200-year-old entity and institution, and we carry those historical moments and barriers and equity barriers, and we are really here to try to dismantle those, take those down, really provide a moment where everybody can achieve the goals that they are dreaming of. And as you can see here, these three kids represent those that we are constituents, the people we are serving, trying to achieve those goals, that gain. So without that barrier, as you can see, they don't need blocks. They don't need the reality that the blocks are much more for certain people than others. They really can experience what they will without the barriers. And so again, those barriers are policies, procedures, and I'm going to talk about that because really, really central to the work that we are doing at CDI. In addition, we want to reflect, and this is part of structural equity, but we want to reflect society. We want to reflect the patients and the community that we are serving. We serve a local and also a national and international patient population. And as you can see here, our patient population on the left side is pretty much, if you look at those underrepresented groups, which includes Blacks, which is in the red, and in the green, you have Latinos. It includes, a total of about over 33% in the total population. But if you move over here to the right, our medical faculty, and I'm focused here on physicians and medical faculty, but we could say this for pretty much all of our health professions, is very underrepresented in those groups. So in the Black group, as you can see here, we have 3.6% Black and 5.6% Latinos compared to the population that you see on the left, really for a total of under 10%. And so this is what, when we talk about underrepresentation in medicine, what we are referring to. And this is the definition that we follow at CDI. It is the AMC definition on underrepresented in medicine, and it is relative. It is those racial and ethnic groups that are underrepresented in the medical profession relative to the numbers in that general population. Just for all intents and purposes here, because it is a local definition as well, we're talking about Blacks, Latinos, including Brazilians. We serve a nice Brazilian population in our health centers, Native American, Hawaiian, and Alaska Natives, and of course other Asian groups, which we also serve, especially in our centers such as Cambodian and Laotian. So I want to now pivot and just talk about three main highlights in our workforce areas that I think that you'd be super interested in learning if you don't already know about them. So the first is our signature summer student program, our summer research trainee program, which, by the way, was implemented and started when we were created back in 1992 in the Department of Medicine. So we're also celebrating 30 years. And as you can see here, our goal here is to expose the UIM students, those underrepresented in medicine students, to academic medicine and biomedical research careers. We are focused on both MD and PhDs. We want students to feel excited about entering the world of academic medicine and learning about what it means to do research in this amazing hospital of ours that really runs the largest research program in the entire country. So we expanded this program this past year to expand to 30 UIM college students. They're here, they've been here now for 3+ weeks with us, and so I encourage you to get to know them. They will be presenting the research projects that they are working on. They're paired with PIs, working working all the way from the basic science labs in the Martino Center, for example, all the way to health policy, health services research in the Mongan Institute. So we have students all across our hospital really paired up with amazing principal investigators who are doing research in so many different novel areas. And you'll be able to hear those presentations later in July 27th and 28th. We're going to be sending all of you, and it'll be in the Mass General Minute, the details so that you can join us. So that's about our program. And as you can see here, we've had close to 400 alumni already. It's so many colleges and universities across our country represented, 155, over 100 medical schools, 38 states in Puerto Rico. We have over 200 preceptors. This is alumni preceptors. We're not including those that are with us this year, which we have a lot of repeat preceptors, but we have new ones as well. And pretty much every single department at Mass General that does research has been engaged with us. So really exciting to partner with all of you in this important effort. I want to now pivot to some trainee initiatives, just some really basic highlights for you so that you can understand what we're doing with trainees, and that's residents and fellows. So we are very engaged in recruitment, and I'm going to show in a moment the amazing match that we had this past year. We also have a very vibrant resident and fellow committee. I'll also tell you a little bit more about that. And we have a mentoring program, a liaison program for our trainees. And here we're celebrating in this picture on the right, our graduates that we recently celebrated. We love celebrating. We love acknowledging accomplishments. So important in really creating an inclusive environment to acknowledge accomplishments and celebrate those who are here doing amazing work. And yes, also the trainees are very much championing anti-racism, as we are through CDI, lots of issues with the policy and education as well. As I mentioned a moment ago, we've been very collaborative in the recruitment season. And these past 2 years, you may not realize this, we actually have recruited all of our trainees, all our residents and fellows virtually. And what this has done, even though it sounded a little bit stressful at the beginning and kind of unknown, is that it created more equity. It created access to many of applicants, medical students who may not have traveled to Boston to interview with us. Really important to understand that residents and fellow applicants sometimes have to travel to 20 different places to interview. It's very costly. And as we know, structural barriers, there's that fence that I talked about earlier. Cost is a huge structural barrier as to why we don't see more diversity in our physician and PhD workforce. We've done a lot of collaboration with these virtual receptions that we bring them to get to know us. And again, back to structural barriers in the finances, we have been able to partner with graduate medical education and our colleagues over at the Brigham to bring a stipend program, now this year no longer a pilot, for economically disadvantaged residents. And essentially this is giving money to residents, $10,000 a year over 3 years during their training when they come to us, for this not to be a barrier for them choosing to come to MGH and the MGB programs, because many of our programs are joint as well. And we also have a low interest loan program that we've been able to develop with GME and Harvard Credit Union. So really exciting that we're able to offer these opportunities to reduce those structural barriers that I mentioned a moment ago. Our match, just amazing. This past year, we just, in fact, starting this past week, we've seen new residents coming in. Our incoming residents are 72 UIM residents this year, which represents 28%. You saw how the UIMs in the general population are about 33%. So we're almost close to the general population in this country with this 28%, which is just such an exciting mark in our history, not just at Mass General, but at MGB as well. And this is how our matches looked like over the years. And you can see here in 2022, where we have the match of 28%. And last year, we also had a record number match of 26%. And you can see over here, over the years, how it has not been any higher than 17% in the past. And the red bar represents Blacks, and the green bar represents Latinos, which were pretty evenly distributed these past 2 years. And we have this amazing resident and fellow committee. Get to know them. If you're a trainee listening right now, get to know our resident and fellow committee. I've listed here the chair, Michelle Diop from Palliative Care. She just started her fellowship, but is an internal medicine alum. And I've listed all the other folks here. So if you know of any of these people in your programs, please reach out and get to know them. They're an amazing resource for all of you trainees. We work very closely with the board. There's a brand new elected board by their peers to provide lots of programming for trainees from social events to mentoring events to really helping with recruitment as well, that wonderful match that you saw a moment ago, and mentoring as well. So a wonderful resource for so many of you that are here listening today. So I'm going to now focus on our faculty programs and just highlight one in particular, but I want you to see some just phenomenal progress that we've made over the years. We started collecting this data back in 2004, and as you can see, in 2004, all of our UIM faculty represented about 4.3%. But today, in 2022, what we are seeing is incredible growth of faculty representing that 9.2%, which is pretty much where we are at the national level. And we're very, very proud of this because when we talk about national faculty, we're talking about historically Black colleges, Puerto Rico. So we are a very large academic medical center, clearly not a historically Black college, but really exciting that we can actually move that needle forward with all these initiatives and programs and the partnerships that we have had with so many departments, clinical and research departments. So we want, again, to acknowledge that. And just one program, which is the Faculty Development Award Program. We have 2 awards in this program. We have a Physician Scientist Development Award and a Clinician-Teacher Development Award, where we're advancing physicians and scientists, so these are MD and or PhDs under the PSDA, 10 years post-training. And just something very exciting outcome that we've been able to document is that we have seen an incredible return on investment. So as you can see here, we're giving them $180,000 over the course of 3 or 4 years, but as we've been able to document since 2006, because the program started in 2004, but we only have data since 2006, that we have seen an incredible almost tenfold in increase in grant money coming in. So very exciting, and really seeing people advance in their careers, get promotions, full professors, directors of centers. Just super exciting that this award has been able to give people, especially our scientists, this opportunity. And then we have our CTDA, which is focused on clinicians and educators. And again, we're giving about $120,000 over 4 years. And we have seen also an incredible increase. Typically, our educators and clinicians don't bring in extra money in grant funding, but look at this, they have brought in and they've doubled the amount of money that we've invested in them almost. And it's been really exciting to see the progress in that space as well. And just here you can see one of those incredible success stories is Marcela del Carmen, who, as you all know, is our current president of our Mass General Physicians Organization. She was one of our first CTDA recipients. And here I'm just sharing the faces of all the women who've won our awards, and actually more UIM women, 42 out of 71 are recipients of our awards over the years since 2004. And this is a testimonial from our chair of anesthesia, who is also an award recipient, a PSDA recipient, on the significance that the award has played in his research career. So thank you, Seyun Johnson-Akeju. So policy, I'm going to end with this final highlight for all of you. CDI has been very busy in the policy space, and what we're doing here is we are trying to create a policy and practice review process and reconcile structural racism in our hospital. And we've started this through medical policies. And we really have 2 charges here. And I'm not going to go through all this, but I just wanted to show you. We really have 2 charges. We have an EPPR committee, which is an Equity Practice and Policy Review Committee, which I chair with Brian French, who is one of the co-chairs of the Record and Policy Committee, Clinical Record and Policy Committee for our entire hospital. That's the way the process goes through medical policy. And we have really 2 main charges. One is to develop an equity impact assessment tool, which we already have done, and then to develop an actual review process that we can apply this equity impact assessment tool. And we can, of course, if people are interested in learning more about this tool, happy to give you information about it, but just to understand that we have identified 26 policies, everything from restraint and seclusion policies to rooming policies for our patients that really we feel need to be assessed through an equity impact lens. Are we actually making sure that these policies don't have bias, that they're being applied equitably, and the impact that they have is actually equitable? So that is really the goal, and we're very excited to let let you know that we are not only working with this policy committee, but also with the patient family committee that is an advisory committee to us as well. So very exciting that that is happening, and you will be hearing much more about this in the months to come. And one of the policies that we've worked so closely on is this patient code of conduct that many of you may have heard about, which is really addressing disrespectful, discriminatory, disruptive, and harassing behaviors. This policy is in the books. It is in Elucid, where all medical policies are, and this is really addressing patient to staff behavior. So discriminatory patient behavior towards our staff, towards our trainees, towards our physicians, towards our nurses, anybody in the space that is seeing patients and even interacting with patients, and even is addressing patient-to-patient interactions. And MGB is now going to be adopting and adapting this policy for the entire system. So we've really led the charge, and now this is happening, and you will again hear a lot more about this policy in the months to come. As an MGB policy, we're going to be providing trainings and lots of education around this space, and really helping everybody understand how to apply this policy. And there's a safer model framework on it, and you'll learn more about this as well. And finally, there's lots of support and reconciliation resources that are available to all of you, including the Employee Assistance Program. And what do we have as lessons learned here? Well, the number one lesson learned is that this is a marathon, not a sprint. Lots of structural barriers. We need to assess and create policies at a minimum. And we need to really, when we talk about leadership commitment, it's about investing in the people we're recruiting and have here. And partnership is super critical in everything that we do. And I just want to close by saying that we're all in this together. You might have heard Heather McGee's presentation a few weeks ago in the MGB Summit. I moderated her panel, and as she tells us, diversity is our superpower. We really need to harness it and build it and know that this is for everyone, because it is not just for those who we might be serving through CDI and other communities. And so future directions, we are expanding. You're going to hear more about us in January 2023. And the fact that we have a retention and recruitment fund for healthcare professionals, all of our medical policies will be reviewed, and that we will be adopting this policy, we'll be serving our community, and we will be publishing in all of this very, very soon. So very, very excited. We have a new annual report we encourage you to look at. It is in our website, and as you can see here, here's our website link and ways to stay connected with us in the future. So thank you so much for this time and this chance to provide you with just a very broad overview, and I'm happy if we have any time left to take questions at this time.
Thank you, Elena. Thank you so much for an incredible presentation and overview of the work coming out of CDI. We've reached the end of our time together today, but we do encourage you all to ask questions and remain connected. I have put CDI and Elena's contact info in the chat, so feel free to reach out to either Elena directly or to the CDI mailbox. And so that concludes our very first Front and Centered. Thank you all for attending. We hope to see you at our next Front and Centered happening on July 28th at 12 p.m., where we'll be discussing the dynamic work of the Center for Community Health Improvement. Thank you all for joining us this afternoon. Take care.
Thank you.